Oh my gosh, it is our pleasure. Thank you guys for joining and helping us set this up. So
Yeah.
Oh, yes.
we have a few students on, is that right? Just three?
It looks like just 3 right now, yeah.
Yeah.
So it might actually help me if I know, are you guys getting ready to graduate? Are you in your junior semester? Like, where are you guys at? Just so I know how to gear my presentation.
So I'll graduate in May with my Associates of Nursing.
Perfect. Okay.
I'll be graduating in May also.
Awesome. Thank you, Megan. Anybody else?
Yeah, it looks like a couple people joined.
Yeah. We can totally give this just a few minutes too.
Yeah, so for those of you who just joined, we're Benefis is interested in knowing where you are in your education and when you'll be graduating.
And you can unmute yourself and answer that question, then mute back.
Can you guys hear me? Graduating.
Yep.
Yeah, let's start with Sheridan.
Okay, can you guys hear me?
Yeah.
Yes.
Sorry, I'm driving. I'm in the first semester of nursing school, so I won't be graduating until 2022.
Okay, great.
Okay, thank you.
Yeah.
Okay, McCall?
I'm in my third semester of nursing school and I graduate in May.
Okay.
Awesome. I think we got them all done. Okay.
Okay.
So we can keep this pretty informal. I do have a presentation that I'll go through. Come on in. So we'll just start with our regular presentation, and then it sounds like we have some nurse internship opportunities with those of you that are not graduating in May. So we'll just keep moving forward. You can have a seat.
Seeing if I needed paper.
Okay. Awesome. All right. Well, just to introduce ourselves, I'm Ashley Regas. I am with our Human Resources Department. I am Kristen.
I'm Kristen. I'm the OB manager here at Benefis.
And I'm Tiffany. I am the educator for our ICU and our PCU.
I'm Kyle. I am the manager of the surgical department.
I'm Nicole. I'm the manager of NICU and PEDS.
And I'm Amy. I'm the manager of organizational development.
Perfect. So thank you guys for joining us. I know your semester's probably been a little wild, probably been since last year. So I really do appreciate your guys' time. I'm going to go ahead and try to share my screen. And when I do that, I think I lose the ability to see you guys. Oh, good. Can you give me a thumbs up if you can see my screen? Perfect. Okay. Well, let's go with you two then.
There we go.
We got some technologically savvy people out there too.
Okay. And if you guys want to unmute, there's not a lot of us on, so I'm okay if you want to unmute and we can just kind of go through some questions as they come. It's totally fine. Some of these slides won't be applicable, so I'll just kind of breeze through. I guess, first of all, I'm super curious how many of you guys have heard of us. I'm hoping you have. Yeah. Okay. Maybe people don't want to unmute. That's fine. Okay. So I just like to always show our recruitment team here. So these are the 4 individuals most likely that you'll be speaking with should you apply to our organization. You can take a screenshot of this. It has our contact information as well. So if you wanted to reach out to us directly without applying initially, if you have some questions, feel free to do so. But a little bit about Benefis. Sorry, I just have to move some things here. So our mission, we provide excellent care for all, healing body, mind, and spirit. And our vision, naturally, is to be the best health system in Montana. We're a small town, as you know, but we are nationally recognized. So I do like to kind of highlight the fact that we've been on Becker's Hospital Review for 6 years in a row for the 150 top best places to work. That's a nationwide recognition, so that's way, way cool. As we know, there's a lot of health systems in the nation. So Forbes also came out of the woodworks in 2018 and 19 with some awards for us. So we got America's Best Employee in 2018 and then America's Best in State. And that Best Employer in 2018 was healthcare specific. So again, that's just really cool going up, you know, with other amazing organizations throughout. And then the America's Best in State, that was just all throughout Montana, so it wasn't healthcare specific. So a little bit about us. I don't have my glasses, so I'll do the best I can from memory. Probably not. We have a little over 3,300 employees. Close to 950 of those are our nurses, and we are teetering on 300 employed providers. So that's just a little snapshot of our clinical crew here. We are non-union, profit.
We're reading for you.
Yes, thank you. I definitely need to have my team. And then we've had annual increases since 2003. So for 17 years, even during the pandemic, we still were given our annual increase. And we also did no layoffs in 2000. Well, since 2003, we've had no layoffs as well. And I was a bit concerned, honestly, because a lot of organizations, I've been doing healthcare for a long time now, but a lot of organizations say they have a no layoff policy until they have to lay people off. And we did not do any layoffs. In fact, our recruitment roared in March, April, and May. We had individuals where census was low on their unit, so they had the opportunity to redeploy. So we had a lot of individuals that were making masks, and I heard yesterday that it was about 30,000 masks that we're up to right now. So we had anesthesiologists, we had nurses, we had all kinds of individuals. We were even hiring new people to come in and make masks for our organization, so that was way cool. We also opened a daycare center. So when the state of emergency was addressed on Friday, Monday morning, we were able to have our employees that had school-age children drop off their kids to our COVID Academy, we called it. So that was really, I think it was a really neat way that our organization did kind of opposite of what a lot of organizations nationwide were doing. So that was really satisfying to us. So just a little bit about us. We do have several campuses here in Great Falls, but we also have Teton Medical Center that's up in Shoto, Montana. And then as you guys may or may not know, we also have a lot of different off-site visits that our providers do throughout the region as well within Montana. So we do have home and community-based services, which is a contract that we get through Medicaid waiver. And that allows us to serve majority of the state of Montana. The only county we actually don't have is Missoula County. They stuck with their same services. So that allows us also to have offices, Helena, Butte, Billings, Kalispell, Bozeman, where we have nurses, we have social workers and office staff there as well, so they can provide those services. We are the second largest employer in Great Falls. Number one is Malmstrom Air Force Base, so I always say we're the largest non-governmental employer. And I guess for me, just kind of a question, we can go back to this at the end too when you guys want to unmute, but it's always important for us to know kind of what is important to you in looking for your, your employer that you're going to be starting off your career in nursing. So I don't know if anybody wants to unmute and tell me right now, or we can talk about it at the end.
I mean, at the end.
Hello. Yeah. Oh, maybe at the end. Okay. No. You're good. You're good. All right, perfect. So a little bit about our employee experience here. So we do market-based compensation. So we have a compensation team that annually is looking at where our jobs are placed. So within our region, within our state, within our nation, to ensure that we are staying up to date with adequate pay for our employees. Our hospital also has shared governance, which is huge satisfier for our clinical staff. So that allows nurses to make decisions on a unit level. And if they affect, the entire health system, or if they need more approval, then they do get presented to Nurse Practice Council as well. So a lot of things have been implemented and changed through shared governance. It can be a clinical change. It can also be a non-clinical change. It can be just, hey, how do we want to celebrate people's birthdays? Or how do we want to improve culture on the unit? Or, how should we do our huddles every morning? So it really can be unique to your unit, which is, like I said, a huge satisfier. So excellent benefits package. I'm not going to spend a whole lot of time on that, but we always try to keep our benefits as low as possible as far as the premiums. And you do have access when you're on our plan. You have access to our employee health plan clinic, which is new as of last year. And that, again, it's like a same day clinic pretty much for our employees. So it cuts down that cost that you might take either going to the your primary care provider if you just need to get checked out for some respiratory stuff that might be going around, or even the walk-in clinic, which sometimes is like $200 just to walk in the door. So I know myself, I accessed it about 4 or 5 times last year and I didn't even pay a dime. So that was way cool. Employee status, 403B, which is our pension plan. You might be used to the terminology 401k. Since we're a nonprofit, it's a 403B. So if at a year you're putting in 2.5%, Benefis will put in 5%. So they basically double that contribution. And after 5 years, you're fully vested, which means that after 5 years, you walk away with all of that money instead of a portion of it. Employee satisfaction. So we are really keep a pulse on our employee satisfaction score. So we do a rollout of an employee satisfaction survey every other year. And for the past 9 years, we've been over a 4.0 on a 5-point scale. So it's really great for us to have that feedback, see where we can improve within our organization or within our own management team. But pulse checks are done 3 times a year. So we do what we call employee forums, which is an opportunity for our leadership to present on specific things that are happening within our health system. So it could be Medicaid expansion, it could be our benefits, it could be our own health system that's expanding. I mean, as some of you may or may not know, we have a Women and Children Center that broke ground earlier this year and is in the process of getting built. So a lot of topics get talked about at those forums, but the pulse checks are an anonymous document that employees can fill out that also gives feedback on, again, what's our organization doing well, what can we improve upon, what's my manager doing well, what can we improve upon, would I refer people to my employer, stuff like that. So 3 times a year, we're getting that feedback. So we're able to kind of keep a pulse on that. So hopefully when we do that every other year, there's no surprises, but So in addition to our annual increases since 2003, we've also were given bonuses, which were surprise bonuses in 17, 18, and 19. And in 18 and 19, those bonuses totaled $3 million each of those years. So $6 million total between 18 and 19 that our employer chose to give back to our employees, which is really awesome. And then we also have a 340B pharmacy grant. This allows individuals that are on our health insurance to access our ambulatory pharmacy at a very discounted rate. So sure, we're all young and healthy and not on a lot of prescriptions, but something as simple as an inhaler or even an EpiPen. EpiPens are a few $100s for a 3-month supply, and people are getting them filled for like $10 to $15 for that same supply. So
Wow.
it is a huge cost savings for our employees and their families. All right, educational opportunities. So we do offer tuition assistance for continuing education. I know you guys are a higher licensure than a CNA, CMA at this time, but I do like to talk about this, that we do offer these growth opportunities, because we do have a lot of individuals that you'd be surprised have started in housekeeping or food service and have been scholarship for CNA or CMA scholarships, and now are even nurses, and some of which are leaders. So I think it's just really cool that our organization really does put that effort into offering those opportunities for all of the individuals here. So we do offer all the ABC classes for our employees. We also offer professional growth, variety of leadership courses, the RN preceptor program, which is way cool. There's a lot of times that I've had nurses that started last year. They went through their preceptor program and they're actually precepting new cohorts that are coming in for the residency. So really cool opportunity. We do offer professional certification pay as well as ops specialist programs. So, and then the clinical nurse emerging leader program, if ever we know that a leader is departing or retiring within our organization, this allows us to open up this emerging leader program for any nurse that's interested in leadership opportunities, about a 6 to 8 month program. And at the end of it, the hope is that you develop into some sort of leadership role, whether it be coordinator, supervisor, manager, etc. So a really good opportunity that we use to grow our own as well. Oh, there we go. Okay, so turnover rates. I do like to talk about this because I think that it's actually happened quite a bit that people are like, oh, you guys hire so much, you must turn over a lot of individuals. So I'll start at the top there. The top is just our national stats, and this is from 2019. So nationally in healthcare, turnover was about 15.4%, and for nurses it was 15%. That's lower than I've seen it in the past few years prior to 19. Usually it's like 17 to 18%. So as a nation, I feel like we're retaining our healthcare individuals. But in Montana, our healthcare turnover is higher than the national average at 18.3%, but our nurses still were retaining below at 11.3%. At Benefis, system-wide, 11.7% for all healthcare individuals. So no matter what position you're in within our health system, that was our turnover from last year. And nurses, we were at 8.7%, so still well below the national average. All of our recruitment is due to expansion or people leaving like acute care settings and going to, let's say, home health or our outpatient clinics or hospice, any of those areas. So those are just transfers within our health system, which then obviously we recruit for that hole that they left on their unit. So we do have a lot of that transitioning happening within our organization. So there's a lot of opportunity to grow into different areas. So you might start off, let's say, medical unit. You really are finding a passion for one of our step-down units or even OB, and you can hopefully work your way into those roles by working with those managers to get you where you want to go. All right, but we can talk about this too afterwards on what areas you're interested in. But I do want to talk about our residency program. So our new grad residency program, we allow new grads to go into any area of our organization. So emergency department, yes. ICU, yes. OB, Peds, NICU, yes. Even the OR, we allow new grads into the OR. It looks very different than our actual residency program. The training's a lot longer, but acute rehab, we have post-acute, as well as senior services and long-term care. So we really, truly do allow our new grads to go everywhere. When you come in as a new grad, you would be part of the residency program, which means that you'll be in about 12 to 16 weeks of orientation. You'll be working along with your preceptor during that time. And then after that, you'll have quarterlies for the rest of the year. And those quarterlies are usually some kind of like social event. I know they've gone like rock climbing at an indoor rock climbing gym. They go and have like lunch in the park and do fun stuff there. So it's a really good opportunity because we not only want you to acclimate to work, we would like you to obviously work hard and play hard is our total theme. So, and then as far as wages, I think that's on this next slide. Oh. So as far as our wages, right now our base wage is $27.89. You would be offered a sign-on bonus. I do have to throw in there that this is subject to change. This is just what we're offering at this time. Just know that if you do accept a sign-on bonus, there's going to be some form of commitment to our organization. And then we do offer shift differentials as well. So $2 more for evenings and $3 for nights. Sorry, my computer's just a little slower. Okay, professional growth. I talked about that a few slides back, but this just kind of gives you a brief snapshot of what professional growth looks like. And you can start applying to professional growth when you start with our organization. And there's certain criteria that you have to meet to complete all three of these levels. But within these levels allows you the opportunity, to gain some different skills, maybe be a part of a committee, maybe become an ops specialist, et cetera. But you also get additional pay on top of that for completing your coursework through the professional growth program. So again, this is just a very small snapshot of that program.
And you can do that one like 6 months into your job. Mm-hmm. So that's something that like our new graduates from this summer, come Christmas time, they're going to be able to apply for that. for the January 1st one. So that one's pretty cool because it's pretty fast.
Yeah. Awesome. Well, I think it might be helpful for us to hear from you guys and what's most important to you. We can talk about the nurse internship opportunities we have. We do have a job right now that's posted on our website, and it's just called nurse internship. You've got to be completing your J1 semester in order to qualify, and you also have to have your CNA license. But we are looking to fill about 25 spots for individuals to complete their orientation and pretty much work full-time status during that orientation while you're on winter break. So you have to be available that first week of December through, for those 4 to 6 weeks or whatever, to complete your orientation on the unit. And then your registry after that. So with registry, you're just able to work when you're able to work and when the department could use you, but there are registry requirements that you would need to meet per unit. So essentially I throw out 100 hours in a quarter, but each unit kind of has their own criteria. So some of it's 200 hours in a year. It really just depends on what unit you're on. But if you guys are interested in those nurse internship opportunities, it's a great opportunity because you can do a little bit more than a CNA. Your scope's a little bit wider. It just gives you some really, really great experience. And I know with clinicals kind of being hit and miss at the moment, a lot of our students that we're interviewing right now, they're really looking forward to potentially gaining an internship spot. But you'll just need to make sure, like I said, that you meet that criteria. So we'll go around the room and just talk about our areas. And then if you guys have any questions, we can certainly answer those for you. Does that sound good? Okay, cool. Yep.
Okay. So I'm the OB manager, and we have about like 50 people on our team. We have a 24-bed unit with a little triage area, and we take care of patients all the way from like an antepartum patient, so when they're still pregnant, through labor, delivery, recovery, and the postpartum and well newborn stage. So our babies and moms stay in the same room the whole time that they're here. We have we have 2 little OR suites on our unit. So if they need a C-section or something a little more emergent, we can do those right there. Our nurses do total patient care, which is pretty much like most obstetric units across the United States. So we have like a scrub tech on 24/7, but again, the nurses pretty much are doing everything with those patients. When we bring on new nurses, they start in the postpartum stage of training or oriented to postpartum for 6 weeks. And then I call it marinating. They just work as a postpartum nurse for a while. And then once you're ready and our unit is ready, then we will move you into like a transition role. And that is when you are kind of the baby catcher and you do the newborn APGARs and immediate resuscitation of that baby. And then you marinate in that role for a while, and then you eventually get into labor training. As far as our intern role goes, it's quite a bit of task delegation to those interns. You solidify a lot of your skills in the OB world with moms and babies that most people don't really get a chance to do in their clinical experiences, especially now with COVID. So they are extra hands when we're doing newborn resuscitations. They're giving our baby baths. They're doing our newborn footprints, and just they kind of get really, they're the support to the nurses on the unit. Other units, they will, sometimes you might take a patient load as an intern, but that on our unit, we really are focused on like, just solidifying those hard skills as a nurse. So.
Yeah. I'll go next. So I actually have 2 departments that I get to talk about. So the surgical unit is new to me. We have a staff of somewhere between 25 and 30. We deal with a lot of everything that needs to be admitted after post-op, after they've had surgery. Pretty tight-knit group up there. It's kind of neat. They go, new nurses go through the residency program with all the med-surg nurses. Have a fantastic orientation process up there, shadowing and following, and then taking your own patient load as a new grad. And you pretty much get up and running and feel pretty comfortable after about 6 to 8 weeks. I mean, at least in where everything is in the process of everything. Granted, it's always a learning opportunity with new surgeries, different processes and everything, but pretty solid program up there. One of the cool things about up there is that you get to work really closely with all of your surgeons of any sort, whether they're the trauma surgeon or the ortho, neuro, all of that type of stuff. You get to work hand in hand with them, and it's a great opportunity to create that collaboration with. The second department that I am going to talk about is the emergency department, which is where I have grown up for the last 16 years. So forever. Our residency program down there is 16 weeks long. It's a little bit more of a learning curve, of course. You guys can imagine you have to be an expert of absolutely nothing, but need to know a little bit of everything. And it's a hand-in-hand program to where you can start with those solid skills first and then move on from there into your more critical patients. One of the strongest things that we really push for is listen to as many normal sounds as you can. So then when you have something that is abnormal, then you start realizing that it is different than what should be. Internship process down there is a little bit different than everywhere else just because of the criticality of the patients. And a lot like what Kristen said is it's skill solidification. So then when you do become a nurse with a license, you're not learning those basic skills of EKG, IV, Foley's, whatever else and whatnot. And you can start working on the additional tasks at hand of the medications and drip rates and resuscitations. And of course, you're always a set of hands down there to where, you know, anything is going on, they're like, hey, come in and help me out. So it's a good experience and good opportunity. Yeah, that's all I got. That's it.
What questions do you guys have for us?
Do you guys require overtime or any like stuff like that?
Require it? That's quite the question. Great, yeah. So the way that it works, so you'll be hired in as a full-time employee if you're going into the residency, and then each unit has like what we call 2490. And each unit is a little different, but just kind of give you a snapshot, which means you'll have to pick up 24 extra hours within a 90-day period. There's always opportunity to pick up shifts. So if you wanted to work overtime, it's available to you. Especially if you have low census on your unit, you may be asked to float to another unit. But yeah, so you would have a full-time status of hours that, you know, we're working you, but there is going to always be kind of an above and beyond depending on what unit you're on. So like with the ED, for instance, it's 36 hours of call within a 6-week period. So theirs is a little bit more than the 2490, but.
Now granted, there is, oh, sorry, no, you're good. There is, you get paid overtime. So it's time and a half on top of that if you are working overtime, even if it is the 2490 or the call, you get paid for your call pay in the emergency department. And then if you get called in, then it is time and a half. On top of that, there is some major incentivized opportunities to where even the 2490, you get paid your time and a half for overtime once you hit your 40 hours. But you also get $15 right now, $15 an hour over that. So that's pretty awesome when you're looking to pay off some bills or have a good Christmas.
Yeah.
And the other thing with that is, I think every hospital now is in Montana is going through our COVID surge. And so I don't know if when you're talking about mandating overtime, if that's a concern of you guys is that you've got this far out. But we are really working and we've been pretty successful in redeploying, like what Ashley was saying earlier. Previously, it was redeploying people to make masks. Now we're really focused on redeploying people to help out ease those units that are really experiencing the surges of these patients. And so I feel like we're doing really well with supporting our team, both trying to keep the overtime down as much as possible, and then also helping people do it willingly versus being forced into picking up shifts. And Kyle talked about that it's pretty tight knit groups. It is, and we find that people really pull together to make sure that they're helping their team. The OB unit is different than both of the ED and the 2490. We pull call based on how much, just to cover to our core. So sometimes it's only like, you only have to do a 4-hour block, and other times it's, you have to do a 24-hour block of call over a 6-week period. But we just know that most of us in here have worked short, and we want to make sure that we're supporting each other and not having our teammates do that. So
I think it's important to address as well that our organization doesn't use any travelers. So how Kristen's talking about staffing to core, that's really important within our organization, making sure that we are proactive in all of our recruitment. We're proactive in how we're scheduling to the best that we can, right? I mean, because things change naturally. But we have done a really great job of not utilizing travelers in quite some time. So, and it's not a model that I foresee our organization going to either, even during these high surges. Our census has been kind of at a new norm for the past probably 2 years, anyways. But obviously with this influx of a different patient load that we're getting, you know, we have a designated unit for our COVID patients, and then of course we have ICU as well, and there's some overflow into other areas, but we do have a designated COVID unit. What other questions do you guys have?
I have one more question.
Sure.
So, our professor told us that, so we have to do a preceptorship to graduate, and our professor told us we weren't like allowed to do it at Benefis anymore. Do you guys know why that is?
Are you talking about like your leadership clinicals?
Yeah, I think so. It's just like 6 12-hour shifts you do under a nurse to graduate.
So Bridget Wiegand Bertha is our clinical educator coordinator, and so I'll have to reach out to her. We are placing for leadership type clinicals right now for those opportunities. So I'll have to find kind of what's going on there. I still have a leadership right now, so
So do I. We're confused. We're perplexed with this. So
Yeah.
we'll get back to you on that one. Yeah, but that's a
Okay,
good
no
question
worries,
to
thank
ask.
you.
what other questions do you guys have? No time like the present. If you came, might as well ask your question. Oh, come on. We couldn't have answered all of them.
Oh.
Okay, I guess I can ask another one.
We're good.
So what would, like, obviously you guys all probably did something different, but as a new nurse, would you guys more recommend like a med surge to get like your basic knowledge down really well? Or did any of you guys go like right into the ER, the ICU or something like that? Like what would you guys recommend to new nurses?
So I'm gonna kind of answer that one. I'm a MSU-Northern kind of alumni. It's been a long time, but kind of. So I was now here in the bridge for my RN through Power, and that was like 18 years ago or more. And I went into kind of a transitional care unit, and then from there transitioned over to a progressive care unit, which is like kind of like a more advanced med surge. And then from there, I went into ICU and stayed for 10 years. So there is that ability to kind of move around when you know, to get your experience. And med surge is an awesome place to start out, get your feet wet, get comfortable with what, like Kyle said, what's actually kind of normal. Because when you go into critical care or emergency care, there are so many abnormals that it's good to know that there are some things that you feel comfortable with that first.
And when I started out in nursing 26 years ago, I went through an ICU residency
program. So I started out in critical care, and currently I oversee the IC residency and PCG residency programs for the new grads. And so I think it allows you a great opportunity to transition into practice and go directly into critical care. It can be very overwhelming for sure, but it's a 16-week program. We offer a lot of support through that program. And really the ICU team is a great team, and they really welcome new grads in there. And aside from getting that 16-week orientation period, they're really great at teamwork and mentoring the new grads into the program and into their unit. So I think it's been really successful for all of them that have gone through. So.
And our critical, sorry, no, you're good. Go for it. Our critical care areas don't accept as many as like our med-surg pod do. They're very restrictive on how many individuals they'll run through because it is so specialized. And we can really focus on you and your skills and building your skills and ensuring you have the appropriate preceptorship as well. So, and we've had people, just to be transparent, we've had people that have gone into ED or ICU and they knew rather immediately, even though that's where they want to go eventually, and along with Tiff and others on the team, that it may not have been a good fit right away. Maybe they do need to go back to, to a med-surg unit or maybe even step down. I'm not sure. But we've had people where we realized and they realized that it wasn't the right fit. And we've had to kind of scale back and put them on a different unit before. And there's nothing wrong with that at all, because it is, as Tiffany said, it's very specialized, and it can be very overwhelming. Being a new nurse, period, is very overwhelming. So we do get a lot of people that they're coming off orientation and they're like, oh, I'm not ready. You're ready, and if you're not ready, then there's going to be people that know that you're not ready, So there are conversations that are always happening, but I just wanted to throw that out there because we've had people that have come on board and they're just stressing themselves out because maybe they don't feel like they're being successful in the ICU residency or the ED residency. And that is okay. We have plenty of other opportunities within our organization that we help people find, a home that was comfortable for them at that point.
And so to the point of how long ago I graduated, so we have the residency programs now where that wasn't available back then to support new nurses in their roles. And so it's awesome, and they're in so many different areas, and so I think that's just an added bonus to kind of help you through being a new nurse and starting on a new unit, and having an educator that's kind of at the elbow with you to kind of guide you and support you too.
And the other thing that I will say, so Nicole and I are managers in the Women and Children's Pod. We have talked at length with some of the med-surg managers, and Ashley talked about the fact that on OB, we can't take 6 new graduates at once. It's overwhelming for us. It's overwhelming for that many people, and we can't give good, solid orientations to everybody. And so I have pretty open conversations about the fact that starting on surgical for 6 months before you want to come to an OB floor is a great way to get a foundation under you, but also move quickly into the area that you want to be. Being open about that from the beginning on the applicant side is really helpful to all of us, just so that we know what your long-term goals are. We at Benefis, I've worked in a few different hospitals, and we are so focused on individual growth. It's awesome. We want you to be where you want to be because we know that's the best for everybody, our patients, our teams, and you as an individual. So again, just even if you're interested in an area and that's not an opportunity right then, because that's how kind of the dice rolls and we've got too many grads at once, that doesn't mean you can't pretty quickly move into where you actually, what your goal is as a nurse to be.
And we're very, very willing and helpful as far as trying to get you, like if you would come to the medical or the surgical ward or anything of that sort. And like what Kristen said, be open and honest about it. We had a new grad actually that was down in the emergency department, and from the get-go, through his interview and everything, he's like, I want to be a flight nurse. That's just what I want to do. All right, well then let's get you there. Here's what we have to do so you can be there. He had to have 2 years in ICU. He had to have the ED experience. And he is now a flight nurse, which is super cool because we knew that that's what he wanted. And we made sure that he had the tools to get there. So it's a foundational piece of it to where, yes, if you guys need to go into med surge prior to, then do it. And like what Kristen said, the emergency department is the same way. ICU is very similar, where we take 5, maybe 6 at a time, because it is a lot of time and effort to make sure that you guys get the education that you need and the experience you need to make you successful. And it is very similar to drinking from the fire hose as far as the information goes. It is a lot to take in. And so to be able to do that, we only take a few at a time. So yeah, if you guys come, then we get you a decent foundation, start those time management skills, that critical thinking, figuring out where your resources are, and then go into one of those more critical areas. Speaking from experience, I went straight into trauma and emergency medicine, and it was a lot. It was a lot, and that was a long time ago, but it was a lot.
And the other thing to go along with that is I think any unit, it's how much you are willing to put in too, because you have to invest that same time that we're investing in you. Whether that's you start on surgical for 6 months and know you want to come over to my department of obstetrics. We have some really hard workers, and those are the people that are really successful in our, regardless of where you're at in the organization. So.
Any other questions? All right. Well, for those of you that are graduating in May, about February, March, you'll see a job opening that just says new grad residency for summer 2021, right? 2021. Yeah. Okay. This has been a long 2020 already. So, so February, March, you'll start seeing that residency position posted. You only have to apply to 1 position. You'll still just get me or someone on my team. You can apply to 10 if you want to spend the time doing that, but you'll still just get me. So, so use your time wisely, I guess is what I'm saying. For those of you that are interested and qualify for our internship, I do have that position posted right now. We're actively recruiting for it. So again, the criteria is you need to be completing your J1 semester right now or higher. You need to at least be going into your J2 semester after winter break. You need to be able to have your CNA. If you don't have your CNA, you can call and get your transcript sent over to the board, and they issue a CNA license for those that are in nursing school. And what else? Oh, you need to be able to at least work equivalent to about full-time hours your entire winter break. So that way we can get you through orientation and compliant and trained and all that good stuff. So that way after break, you can just pick your schedule as you see fit. So if you guys have any questions, please reach out to me. I know that your guys as instructors have or the Career Center at least does have our contact information. But if not, hopefully you took a screenshot of our pretty little faces and have our contact information. So
Thank you guys.
you guys are so welcome. Thank you for showing up, and good luck this year. I know that it's been kind of a whirlwind for everybody, but you guys got this for sure. And I look forward to hopefully talking to you guys here in a few months. Thank you guys.
Thanks so much,
Yeah.
Benefis.
Thank you guys. Appreciate it.
Have a great day. Stay warm and safe.
Okay, see ya.